Okay, before we go too much farther here, let me back up because we haven't really talked about all of the benefits of melatonin in the human body, right? What is it doing to the human body? Because, and I want to touch on this, but I would love for you to expound on it, but it is one of the most powerful anti-cancer hormones in the body, and it's also an antioxidant, correct?
Absolutely. Its anti-cancer effects go back a very long time. Within 10 years after the discovery of melatonin in 1968, Vera Lepkin, a scientist in Europe, described the inhibitory effects of melatonin on cancer cells. A very crude experiment because at the time there were not a lot of sophisticated methodologies, but that observation has been exploited in hundreds, thousands of publications since then. Melatonin is a reasonable agent to consider when it comes to cancer. Most cancers are age-related. As you age, your ability to produce melatonin wanes. Many diseases are age-related, and many seem to be related to the reduction of melatonin, because if you substitute melatonin, you can delay, defer, forestall many of these conditions, including presumably cancer. I think people who routinely take melatonin for sleep, for example, don't realize that they are getting other benefits as well, likely as an anti-cancer agent, and certainly as an antioxidant. It is very powerful antioxidant, much better, for example, than vitamin E or vitamin C. I'm not disparaging those antioxidants, but relative to melatonin, they are second class.
So I've seen studies and research that you're alluding to here that melatonin suppresses tumor growth, suppresses cancer growth. And obviously that becomes very important for someone who wants to prevent cancer, or someone who has active cancer. It becomes very important that they get really, really good quality regenerative sleep, that at night their body is producing as much melatonin as possible before we get into the supplementation conversation, right? So maximizing melatonin production naturally is definitely a good thing, which means going to bed earlier, sleeping in total darkness, not interfering with your sleep with blue light, and putting those things into practice makes a lot of sense. Now, melatonin also, it's part of your body's repair and regenerative processes, right? Because when you sleep, that's when your body is repairing, right? That's when you're resting, you're regenerating, you're repairing. And so with low levels of melatonin, your body is not able to adequately repair and regenerate and perhaps suppress tumor growth, which leads us to this other little talked about problem. I actually talk about it in my book, but which is that there's a number of pharmaceutical drugs that suppress melatonin production, right?
Indeed, there are. Of course, many people who are hypertensive are on something called beta blockers. Beta blockers are very good to treat hypertension. However, they also impede melatonin production because the mechanism by which the nervous system enhances melatonin synthesis in the pineal gland is via beta-adrenergic receptors, and those receptors are blocked by these drugs. Quite frankly, most drugs have not been tested relative to specifically inhibiting melatonin, but surely a number of them do. I also want to go back to your point about cancer and misuse of light at night. It is well known that individuals who work night shift, for example, or do frequent transmeridian travel where they're in jet lag all the time, have an increased cancer risk. Indeed, pharmaceutical agents, some, we don't know how many because they have not been tested, impact our ability to produce melatonin for sure.
There are hundreds of documented pharmaceuticals, but as you said, there may be many more. I found a quote short list of several hundred when I was researching for my book that were known to suppress melatonin, and it was kind of a big epiphany for me. The light bulb, like, oh no, right? Not only are our daily lifestyle habits and our daily routines, our nighttime habits, reducing our body's production of melatonin, but then many of us are taking pharmaceuticals, or if you're in cancer treatment, you're definitely taking pharmaceuticals, and then that's suppressing it even further. And if this hormone is as powerful as we think it is in regards to healing and suppressing cancer growth, then we should be doing a lot more to make sure that patients and just regular people are optimizing their melatonin, right?
Absolutely. That would be a reasonable thing to do. And of course, all individuals who work on melatonin are very familiar with this idea, and individuals like you and those who take it for sleep also. But melatonin, in my opinion, should be more widely used because of the misuse of light, and especially during aging. There's just so much experimental evidence that would suggest that we could reduce the untoward health effects that we experience with aging by supplementing with melatonin. This is one example. I'm 85 years old. I've been taking melatonin for 28 years. Knock on wood, I'm in still very good health, but there's a lot of my colleagues who have worked on melatonin who do the very same thing and are doing very well. I say that's not a controlled study, but animal studies unequivocally show that deferring age-related diseases is possible with melatonin. Not only cancer, neurodegenerative diseases. I'm just writing a paper now on Alzheimer's and melatonin. And that's a very, very debilitating condition.
So I think a lot of people will be surprised to know you've been taking melatonin 28 years, you said, and
Right.
You take melatonin during the day, correct?
Well, that's not exactly accurate. I always take it at night.
Okay.
Before bedtime, because that's the time melatonin would normally be increasing. I have taken melatonin during the day, and there's justification for that. Again, this isn't a recommendation necessarily, but we know that the cancer cell metabolism is different at night than during the day. It has a better positive metabolism at night that's directly related to the availability of melatonin. So cancer cells, in some regards, are more cancerous during the day than they are at night. And they are less cancerous at night because they are exposed to melatonin, which changes their metabolism, called a Warburg effect. So in some cancer cases, it may be worthwhile to take melatonin during the day.
Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.